You're watching CTOM TV. Knowledge is power. Hi, everybody. My name's Michelle Morand. This is Alexander Rowland, and we're co-founders of Cancer Treatment Options and Management, an independent and worldwide cancer research and advocacy organization. And today, Alex is here as a precision oncology expert to give you an update on what's been happening in cancer this last week. And specifically today, he's going to talk with you about updates for HER2 positive breast cancer.
Yes.
So what's new with HER2 positive breast cancer?
Well, as you know, HER2 positive breast cancer has kind of been the poster child for targeted therapy of precision oncology. And that first started with the development of one of the first humanized monoclonal antibodies, Herceptin, also known as trastuzumab. And so Herceptin binds onto the HER2 receptor. And in women that had HER2 positive breast cancer, Herceptin was just a miracle drug. It's done some wonderful things with women, just radically changed this disease. So then a few years later, pertuzumab came on, and that works by a slightly different mechanism. And so now patients who relapsed on the Herceptin have a second drug, pertuzumab. And the combination of the two drugs has been very, very effective. So after a while, these drugs stop working. And also these drugs are, there's some speculation as to whether they work on brain metastasis, CNS metastasis. Since then, a new drug was developed called TDM1, and that basically refers to trastuzumab emtansine. And basically what this drug is this is what we call an antibody drug conjugate. And so it uses trastuzumab, the antibody, to bind onto the HER2 receptor of HER2 positive cells, and it brings in the cytotoxic agent emtansine, which is a microtubule inhibitor, which is also known as DM1.
Okay.
So this is a form of targeted therapy, and when this drug came out, it really made a big difference. In women who were pretreated and who had relapsed on chemo and Herceptin, this drug was quite a breakthrough.
This is TDM1?
TDM1, yeah.
Or TDMI?
TDM1.
Or is it a 1? Okay, thank you. Okay.
Yeah, so, you're probably right. It's probably TDMI.
Is it?
Microtubule inhibitor. I call it TDM1, and so does everyone else, but it's probably an I.
Okay.
So anyways, in a recent study, this drug, previous study, the disease-free survival in women that had stopped responding. Now, once again, this is women that have had Herceptin and pertuzumab and chemotherapy, and they haven't responded to it, or they've stopped responding to it. So in a recent trial, the disease-free survival was 88.3% in women getting TDMI or 1, and 77% for just Herceptin alone.
After how much time? Or is there a time associated with that?
No, there wasn't really a time associated.
Okay.
This is just a brief overview of this drug.
All right.
It's also active in CNS metastasis.
Okay.
So TDM1 was a bit of a game changer recently. Now, what about women who progressed on TDM1? What do they do after that? Well, now we have 2 recently new approved drugs for this. Okay. So, this is just incredible for HER2 positive breast cancers. We have so many different options now.
Yeah, after people have stopped responding to
the initial one, we got TDM1, and then after that, we've got, so when people stop responding to Herceptin, we give them pertuzumab. When they stop responding to Herceptin and pertuzumab, we give them TDM1. And now, once they stop responding to TDM1, and more specifically, when they get brain metastasis, we have a couple of new protocols. So the new drug that was recently approved, a breakthrough designation in December of 2019, is called tucatinib. And tucatinib combined with Herceptin and Xeloda versus Herceptin and Xeloda alone, which is commonly used in as a last resort.
Mm.
So a recent study looked at the combination. So tucatinib is a small molecule inhibitor, so it's a new classification of a drug against HER2. And in a trial of heavily pretreated women that have had pertuzumab, Herceptin, TDM1, and whom had central nervous system METs, they compared tucatinib plus Herceptin and Xeloda to just Herceptin and Xeloda. And so the 1-year progression-free survival in this group of patients that would normally have fairly poor response was 33.1% compared to just 12.3% for Herceptin and Xeloda. So just adding this drug is making a huge difference. Importantly, the 2-year overall survival for this was 44% versus 26.6% for the doublet combination. This drug results in a 52% reduction in risk of death.
Wow.
So just another game changer for women with HER2.
Late stage.
And just approved 2019.
Wow.
December.
And when you say breakthrough designation, tell us what that actually means.
That means they've applied for the designation and they're speeding up the process because of the results of the trial.
Okay, so the FDA is helping to move this along faster because it's gone so well and has so much benefit. Okay, so that's...
So now there's another drug that was actually completely FDA approved in December of 2019 called trastuzumab deruxtecan.
Okay.
Deruxtecan. So this is another one like TDM1, but it's a different chemotherapy drug. And so this is an antibody drug conjugate of trastuzumab, except it uses the chemotherapy drug deruxtecan, which is a topoisomerase 1 inhibitor. And so in a trial of, once again, heavily pretreated women that have had pertuzumab, Herceptin, TDM1, chemotherapy, and who had CNS metastasis, and they've also received at least 2 or more prior anti-HER2 therapies, so they've had a bunch of different combinations. In this group of patients that would really have no other options, just this drug by itself, not a combination, produced an overall response rate of 60.3%. And so the duration of responses was 14.8 months.
Wow.
Yeah, so that's a, kind of like a progression-free survival.
Wow.
And that ranged from 13.8 months to some patients getting as high as 17 months. So 2 new radical game changers, one with complete FDA approval, the other with breakthrough FDA approval in December. So, these drugs are going to be in use right away.
Right, they're available.
They're available.
Excellent.
And that's it. I just wanted to keep cover that.
Great.
Great news. Just amazing
That
news.
is very good news. Absolutely. One thing I want to add to that for the practical application of this information is because these things are so new, just getting this breakthrough designation or just getting this FDA approval, it's very possible that if you go to your doctor next week and say, hey, I saw this video and this cancer researcher talked about this stuff, they might not have heard of these, or they may think that they aren't available. So you've heard it here. They exist. There is data, clinical data, and they are available. It just might be, you might be the very first person to bring this to your doctor's attention. Don't take no for an answer. If your doctor needs some backup information, that's what Alex and his team are here for, is to provide you and your doctor with the clinical evidence that allows them to provide you with these new innovations in treatment. So reach out to us at ctome.com if you like. And if you want to see more videos that Alex has made, you can go to his YouTube channel at thecancerguy.com. There's a whole playlist about breast cancer, lots more information there for you to explore. Great. So we'll see you next week with the weekly update, and hope you make good use of this information.
Thank you for watching CTOME TV. Subscribe below and stay informed.